For a deeper look at what has been happening in Regina, I'm joined now by Regina's Chief of Police, Bray. Thanks for your time.
Thanks for having me.
Now, before COVID-19 was really on our radar, the opioid and overdose crisis was really becoming a serious problem in Regina. How have things changed since earlier this year?
Well, it certainly hasn't got less serious, I can tell you that. We've been dealing with a record number of overdoses in our community. And when I say we, obviously the police are attending a lot of those calls, but many of them, it's obviously the health region, EMS are taking the lead on. And this is becoming a real challenge for us. So drug enforcement and digging into this opioid challenge, trying to come at it from the enforcement angle, which is really what the police look at, and then working with our partners in the Saskatchewan Health Authority to try and deal with it from the addiction side, is as big of a problem, if not bigger today than it was pre-COVID.
When it comes to overdoses in Regina, what kind of drugs are we dealing with, and what can you say about where they're coming from?
Well, so we obviously know that that fentanyl is causing a lot of the serious health challenges, the overdoses that we're seeing. Sometimes it's other drugs that are laced with fentanyl. Meth has continued to be a big problem in our community, and obviously is something that we are still really challenged by in terms of what it does with regard to community safety. Meth is a highly addictive drug that causes people to engage in very risky behavior, oftentimes committing criminal offenses just to try and kind of fuel that habit that they have. And again, if we can't help them deal with their addiction, which is a health issue, then this cyclical problem just continues in our community. So predominantly meth and fentanyl. As far as where they're coming from, a lot of it is not being manufactured in our city. A lot of it is being brought in. We have officers that have done a lot of good investigative work trying to limit the amount of drugs coming into our community, but that's a very daunting task and something that's not unique to Regina. Saskatoon, Calgary, Edmonton, all major cities within Canada are struggling with this same issue, and really trying to deal with it from an enforcement standpoint is only one part of the equation.
That actually leads to my next question. When you guys are sharing the numbers of overdoses or in some cases deaths, why are you choosing to share harm reduction services versus focusing on the criminal aspect of drugs?
Well, I think it's, when you're talking about drug and drug addiction, there's lots of different ways we have to look at it. So the decision that was made, for example, to equip our frontline officers with Narcan is really about us trying to save lives. And you can't stick your head in the sand and think that there isn't a drug problem out there. There is a big drug problem. And so anything that we can do to help save a life is important. But coming at it from the health side and trying to really help those that suffer with addictions is important as well. And the only way that we're really going to solve this problem is truly helping those that are addicted. The enforcement side of it, that is a constant piece of work that we're doing in our police service. We've made some huge arrests. We've made some large seizures of drugs and drug-related paraphernalia, and that continues. We've got big investigations going on right now, but clearly, as long as you have people suffering with addictions in our community, that enforcement is only, again, one piece of the puzzle.
As a force, how are you guys doing in terms of PPE? COVID is something that could go on for a very long time. Have you been able to access what you need to keep your officers safe?
Yeah, we had a fairly good supply in some regards prior to COVID. The reality is that we're in the business of dealing with high-risk individuals on a regular basis. So take COVID out of the picture, dealing with people who have communicable diseases. Oftentimes there's blood at scenes when we're there, and so having on hand a large number of gloves, for example, or masks, those are things that we typically will keep within our stock here at the police service. That being said, our partners at Regina Fire and Protective Services have been outstanding. We've been working with them. And through the Saskatchewan Public Safety Agency, there's been a lot of coordination of PPE for, I would say, all frontline emergency services in the province. And so we feel as though we're in good shape. Our members are trained and equipped with PPE, and we're quite optimistic that we're going to be fine as we work through this pandemic.
Thanks so much for your time, Chief Bray.
Awesome. Thank you very much.
Police Chief Bray joining us in Regina tonight.